I want to welcome first to the stage Senator James Manning. Senator, come on up. Thank you, sir. Chair of the Universal Healthcare Task Force. There's a microphone right there for you. I really appreciate you making it up here to be with us here today.
Well, thank you. Oh, this works very well.
Yeah. So let's start. And John, let me ask you to start our timer so that it runs down and expires at 12:45. Let me ask you first, sir, tell us about the task force. Tell us about the work that has been underway there that you have been leading.
Okay, the task force, first off, let me offer an apology. I have a condition called spasmodic tone dyslexia. And what that means is that the vocal cords and stuff vibrate on their own sometimes, and it disrupts my speech patterns. The good news about it is that it's not contagious, so don't get up and run out the room. And I am receiving treatment through the VA, and what they do is they provide Botox injections in my throat and stuff in order to stabilize this. So I'm going to do my best to speak clearly and hope that everyone can hear me. And so with that being said, the question was about the task force. What does the task force look like? The task force has not been appointed. It's going to be a combination of 20 people, 4 legislators. We had 2 from the Senate, 2 from the House, which the Senate President will appoint and the Speaker of the House will appoint. And then the others will be appointed by the governor and will require Senate confirmation. So it hasn't happened yet, but we're trying to speed the process up because with healthcare, time is of the essence, and we got to do a better job. We got thousands of Oregonians in rural areas that don't have health care or have access to health care. My hope is that this task force, and I'm a member of it, will be able to guide us to a place where we can fix that problem.
So tell us about you and your approach. How did you get involved? How did you decide to take up this mantle of healthcare? Tell us a little bit about your background so folks can get to know your biography and your story, and what compelled you to say, I'll serve on this committee.
Interesting. I remember as a kid growing up, I grew up very poor. I didn't have health coverage or anything like that. And even going up into my adult life, I used to sell health and life insurance, and I saw how expensive it was, and a lot of people couldn't afford it. Fast forward to my time in the military, I visited a lot of different countries, Panama, where they have a place called a Social Security hospital, where if you're injured so badly that you're just out on a hallway waiting, and if you don't have family members to come in and provide for you, you don't eat, you don't bathe, or anything like that. And then I was fortunate enough to spend my last overseas assignment in Australia, where I got a chance to experience universal health care. I saw it work. It worked perfectly. I didn't see anybody that went without health care. Yeah. When I got back to the States in 2005, I see that we're still struggling here in America. I see that people, grandma and grandpa, are cutting their pills into 3s and 4s, trying to make their medications last longer, when in fact they're not getting the proper dosage. I see kids out here suffering, and I'm thinking that this is wrong. So I was privileged to connect with Healthcare for All, and they told me about this vision that aligned with mine, a universal health care coverage, to make sure that if you are an Oregonian, you live here in this state, you get health care. And we got together, laid out a pathway, and I got a lot of my colleagues. We tried to do this in 2017. It didn't make it. But this time around, we got more than half of the state legislators to sign off on this bill to move it forward. And here we are. I'm really excited about this, the prospect. We're not there yet, but we're moving towards it.
Yeah. What have you found about the healthcare, and again, it's early, but you got to experience some of this during the legislative session on this legislation and others. What have you found about the healthcare stakeholder community that might be different from other stakeholder communities that you work with as a citizen legislator? How is it unique when you are experiencing or engaging with those healthcare folks?
It is unique to the degree that we have so many sub-pockets. We have a COFA community that are American citizens, but for whatever reason, there are certain qualifications for healthcare that they don't meet. So every biannual, we have to renew healthcare coverage for them. We did a bill called Cover All Kids. It's another population that we did. In 2018, we did 450,000 Oregonians that didn't have health care. And all of these peace things that keep going on. I talked to a neighbor that pays $1,200 a month for premiums for health care. Yeah. That doesn't include his out-of-pockets or his deductibles. That is unsustainable if you are a wage earner, a worker. How can you afford that? And people are on the cuff where they can just $2 or $3 short of meeting the requirements to get health coverage. So this is wrong. We need to fix this now.
So how would you characterize, let me move it out of policy for a minute and move it into politics. How would you characterize the nature of healthcare within your caucus as a political issue? A lot of people want to do something about healthcare in the Democratic caucuses, but knowing what to do is sometimes a complicated task. Characterize for us the kinds of conversations that you have with other caucus members about where the Senate Democratic Caucus might move Oregon forward.
Well, with Senate Bill 770, which is the universal health care bill, we had Representative Salinas. She had a bill that she had been working on a number of years, looking at Medicaid buy-in expansion and, single payer, all the costs and stuff that is associated with this. So on the Senate side, I've got overwhelming support. Every Oregon Democrat senator voted in favor of this bill, which is really remarkable in itself. The disappointing, and I don't like to draw any kind of partisan lines or anything like that because healthcare is not a political issue. Yeah. It is a human issue. And in our rural communities, there are thousands of people that don't have health care coverage. So I thought that this would be a win-win for everybody, but it didn't turn out as much. I do want to thank Senator Brian Boquist for his vote in the Senate to support universal health care. I thought that was, it made a difference to know that it is a bipartisan impact, a bipartisan approach. And more importantly, we need to keep focused on who needs this type of health care. Yeah. And it's a lot of people that don't have it right now.
So tell us more about you to the community that is engaged, involved in politics, but maybe isn't walking the halls every day of a session. How did you decide to run for office, for the Senate in particular?
That was really unique. I spent 24 years active duty United States Army, so maybe this condition with my voice as a former drill sergeant, maybe this is what's causing this thing to occur.
A little karma, maybe?
Yeah, a little bit karma. Yeah, it does come back. But I retired in 2007, and I was recruited by a warehouse company, which brought me to Eugene. And when I got there, I started getting involved in a lot of the local nonprofits, our HOA, for example. When people are going, and this is for the kids that are out there watching, the young students. Don't let people make decisions without your input. So I decided that, okay, I would get involved with this, and my background in law enforcement and criminal justice, I applied for and I got appointed to the Eugene Police Department. The police commission, and I gotta say, I'm really proud that during my tenure there, we did the first prohibiting profile policy in the state of Oregon. Now we've expanded that in the Senate. or in the legislation. So that's a big accomplishment. And then I got a call one day saying that from, at the time, Representative Al Hoyle said that, asked me if I would run for her vacated seat in the House. And I said, well, sure, I'll run. I got a call from another friend of mine, Pat Farr, who was in D.C., asking me to run. I am not a politician. I am a public servant. So I didn't know anything about this. I said, sure, I'll do it. And I had a dream, and I told my wife about it. 60-40, or something horribly is going to go wrong. And I was right both times. Something horribly went wrong. My opponent got 60, and I got 40%. So it was a blowout and stuff, you know. And then I got the same from Val, called me up saying that Senator Chris Edwards was thinking about resigning. Would I seek his seat, appointment to his seat? And I said, sure, I will. And eventually, I got appointed to the Senate, and I ran in 2018, and I won with the nomination of the Democrats, the Republican, Independent, and Working Family Party. So everybody was behind me. I got 98% of the vote, 98.5% of the vote, and I'm still baffled about that 2%. I'm trying to figure out what did I do to tick them off, you know, but I definitely want to talk to them because I want to make good for them as well.
Yeah. So how do you find good sources of information on healthcare when, as a citizen legislator, you know what you know coming into the job, but healthcare, even if you spent 40 years in a career there, there's still parts that you ain't gonna know about very well, you know? So how do you learn about how to inform your vote? Who do you rely on for trustworthy information that, you know, represents a perspective but you know is straight fact? How do you garner enough information to be good at your job when healthcare was not your professional career?
That is a great question. One of the things I do is that I talk to people. I talk to average people that have health care, don't have health care. I talk to the practitioners. I go out to the various organizations that are providing health care for substance abuse, for mental health issues and things like that. I go to the schools, I talk to the students, you know, to learn about some of the things that they're experiencing in terms of medical needs, my own past experiences, and I do talk to the professionals. Yeah. We've got some amazing healthcare practitioners here in the state of Oregon, and I want to make sure that they have all the tools that they need. As a matter of fact, I want to engage in a conversation to get more practitioners out there by way of a grant program, which means that they will be able to go to school fully paid for, and they have one requirement is that once they graduate, get their degrees, then they have to perform the job in rural communities for 2 to 3 years in order to satisfy that. I think that is a great way to raise awareness. I think it's a great way to get more practitioners involved. And not only that, is that we don't have people going to school with crushing debt that's going to follow them forever.
Senator James Manning on the Joint Task Force for Universal Health Care. Thank you, sir, for coming up from Lane County. Let's give him a round of applause.
Thank you.
Thanks, sir. Well done.